Before I saw Dr. Fonce, I had been suffering with hip pain for almost 2 years. I had been attacked by a pit bull who, after he bit me, knocked me to the ground and I fell on that hip. Prior to that, I never had any hip problems. Before I had the replacement, for that year to year and a half, I was at the point where the pain was so severe I was having to use a walker. Before I had the incident with the dog who attacked me, I was a very active person. I walked and walked and walked all the time. I enjoyed my walks. I do interpretive dance at my church. All of those activities were curtailed, even to the point where I had difficulty getting in and out of my vehicle. When I first met Dr. Fonce, he was very patient with me. I had lots of questions because it is a serious step to be taking, and he took the time with me. I really liked that because sometimes you feel like you're really rushed through a doctor's office, and he was friendly and he explained the whole procedure. The traditional way of replacing a hip, the incision is made more towards the posterior side of your hip. And from what I understand, it involves cutting more muscle and tissue to get through to the hip. With the anterior approach, it's more in the front of the hip where they do the surgery, and so there's a lot less tissue to cut through, and therefore the recovery time is much quicker. And my recovery time was phenomenal. I was walking without assistance the week after surgery. I think the thing I was most pleasantly surprised about was that, sure, there was surgical pain, and I knew that would happen. I've had surgeries before, but when I put my weight on it, there was no hip pain. And that was such a difference from previously, where I could not walk, I could not function without my walker helping to support my weight to keep the weight off of that hip. If I ever needed my other hip replaced, which hopefully I don't, but I would definitely come back to him. And I've already told people where I live that if they ever need a hip replaced, he's the man to go see.